Hi, my name is Adebayo Christopher Adedoyin. I supply anesthetic consumables to Nigeria Hospital. Today, we are going to be discussing one of the intubating medical devices, which we call the laryngoscope. Now, what is laryngoscope? What is it all about? A laryngoscope is a medical device which is used during laryngoscopy and tracheal intubation during general anesthesia. It can also be used when packing the throat, when introducing the nasogastric tube into the airway, during pharyngeal suctioning, and when removing foreign bodies from the airway. I mentioned three basic words which I feel that you may not be familiar with. They are the laryngoscopy, the intubation, and the anesthesia. Now, what is laryngoscopy? Laryngoscopy is a word or is a medical term which involve the viewing of the larynx. It is made up of two basic words, which is the larynx and scope or scopy. So the word larynx is a medical term which involve the part in the human respiratory system, and we also call it the voice box, or it is a place where our voice is being generated. Okay, why the other one, which is scope or scopy? Scope is a word or is an English word which means to view or to look, to sight, to examine. So when you combine these two words together, you have examining the larynx, or viewing the larynx, or looking at the larynx. Alright, why intubation? Intubation means the medical procedure which involve the introduction of endotracheal tube into the trachea or into the airway. What do I mean by this whole grammar? I mean, when passing, this is endotracheal tube. So when passing this tube, or the process of passing this tube into the airway, is called the intubation. And when doing this procedure, you will need this medical device. So this is the laryngoscope. So if you must pass this particular device into the airway during general anesthesia, you will need this to open the mouth. So that process is what we call the intubation. So the other one, which is anesthesia. Anesthesia is a medical procedure which involve the reversible loss of sensation with or without loss of consciousness, and generally it involve the pain management during medical procedure or during surgery. And it is made up of three types, which are the general anesthesia, the local anesthesia, and the regional anesthesia. But today I will not dwell much on it because it is not our major topic. Now let's go straight to our laryngoscope. So laryngoscope is made up of three different types, which are the standard laryngoscope, the fiber optic laryngoscope, and the video laryngoscope. But meanwhile, I will not also talk more on the video and the fiber optic because I will do another video that relate to that two topics. But today, let's stick to the standard laryngoscope, or the normal laryngoscope, or the conventional laryngoscope. So the laryngoscope is this how is it look like. So this is the standard laryngoscope, the one we are used to, or the one that is commonly used in the either in the operating theater or in the medical field. So I will talk about the various parts. Basically, it is made up of two parts or two components, which are the handle and the blade. So let's talk about them one after the other. This is the handle. So, and the handle does one thing which help in generating the power. So it is the part that help in the power generation. So meaning it has two battery inside. So, and if you press here down, you see that light is being generated. So it is the power source. And this is the blade. So in discussing the blade is made up of three different types, which are the McCoy blade, the Macintosh blade, and the Miller blade. So the Miller blade is a blade that is used when dealing with the pediatric cases, like the neonate and the infant. So when dealing with those cases, so we use the one of Miller. And Miller has a straight blade. This is it. So Miller has a straight. So if you look at these two types, now you know that there's a difference. One is straight, the other one is coil. All right. So this Miller is used when dealing with the pediatric cases. All right. Why this is Macintosh. So Macintosh is a type of blade that is used when dealing with a normal adult. Why the McCoy type is the one that is used when dealing with a difficult intubation. You may ask me, what is difficult intubation? Difficult intubation is when the anesthetic is unable to pass the endotracheal tube into the airway as a result of not being able to see the or view the larynx. So when the anesthetic have tried like 3 times or 10 minutes, so it is termed as difficult intubation. So by then it can order for the McCoy type of laryngoscope. But if after ordering for the McCoy and is still unable to to view the larynx, then it can order for gum elastic bougie. Alright, so those are the devices for difficult intubation. Now, this is how the laryngoscope come. But meanwhile, let me just tell you the various parts of this blade. So this is the flange. This is the flange. This is where we call the tongue. This is the tip. This is the hinge, and this is the hook. There's a particular hook here. So these are the various parts of this blade, and this is how it comes. So this is how it comes. So if you look at it very well, you have 3 different blade here. You have and it is of different sizes. But normally before now, this particular part we have size 0, we have size 1, we have size 3, and size 2, size 3, and size 4, making five different blades. But of recent, they have reduced the blade to 3 different blades in each of the pack. So it's no more 5. So the reason why I'm saying this because I supply this same device to one of our clients, but because he's used to the one that has a 5 blade or 4 blade, so she actually tried to reject it. So it was after much talk and after explanation before she was able to accept it. So it's now with 3 blade, no more 5 blade or 4 blade. So it comes with 3 blade, size 2, size 3, size 4, and with the handle. So this is the handle. So this is how it comes. So this is the part, and this is the Macintosh type. So this is how it comes. So this is how it comes. So how it comes. All right. Why this is the Miller? Remember I told you earlier that the Miller is used when dealing with the pediatric cases. So this is the Miller type. So this is how it comes. The straight blade. The old one that I showed just now. Straight blade. This is it. So this is how it comes. This is it. This is it, and this is how it comes. So this is how it's being. This is the video. God, this is what I have for you today. Thank you for watching. God bless you. And please, if you know you have not subscribed to my YouTube channel, so please do subscribe because I do produce video on a weekly basis. And remember, I supply anesthetic consumables to Nigeria hospitals. So please do patronize me. And as you do, God bless you.